Welcome to Pregnancy and Birth Diaries. Today I want to talk about postpartum depression again because I think this topic needs to be talked about and discussed widely and taken seriously. Studies show it can harm the bond between the mother and baby. Sometimes due to the mother's condition, the baby might not be treated well and might face negativity. This can really affect how the child grows and learns. About 1 out of 7 women can develop postpartum depression, PPD, and there's no specific way of knowing whether you will have it or not. You cannot really predict it. So today we will go into the symptoms and how you can prepare in advance in case it happens to you. PPD affects usually women after childbirth, but there is a possibility of it starting during pregnancy as well. There is no concrete cause of PPD, but it is believed to be caused by a combination of physical, emotional, and lifestyle factors, and the rapid drop in hormone levels, estrogen and progesterone after childbirth could also be contributing to mood swings and emotional vulnerability. I mean, childbirth presents a challenging and draining experience on its own. Plus, throughout pregnancy, women undergo significant hormonal, physical, emotional, and psychological transformations. And all these changes significantly affect us women. Additionally, sleep deprivation, the stress of caring for newborn, changes in routine, and the physical recovery from childbirth can all contribute to feelings of depression. For some women, a history of depression or anxiety, lack of strong support system, or experiencing major life stressors during pregnancy or after childbirth can increase the risk of postpartum depression. Before we go into the symptoms of PPD, let's distinguish PPD from baby blues. Typically, baby blues happen around 2 to 5 days after giving birth and usually gets better by 10 or 15 days later. You know you're having baby blues if you are having crying episodes, feeling sad, anxious, or easily irritated. I remember I had 2 crying episodes after childbirth. Both happened under circumstances where I wouldn't normally cry. So while I was crying, I made a mental note that this was an odd behavior for me, and also found it kind of amusing because it was so strange and sudden. The first episode happened when I felt sad and nostalgic about the times during my pregnancy, and realizing that it was over made me really sad, and I just started crying uncontrollably. The second time happened during lactation consultation when the consultant said something very kind and I started crying because I felt sorry for myself. That one was embarrassing. So clearly here for me, those were just separate random episodes, and mentally I was feeling as usual overall. Okay, also when you have baby blues, your sleep and appetite might change and you could feel confused and very tired. But it usually doesn't stop you from taking care of your baby, having warm and nurturing feelings for your newborn. And it does not stop you from doing your daily chores and just kind of being yourself. And generally, when you have baby blues, you will get back to normal pretty quickly, while PPD tends to be prolonged and significantly prevents women to get back to normal functioning. So when it's PPD, you might feel really down and have less energy. Things you used to enjoy might not interest you anymore. It can be hard to focus. For example, the little things that used to bring you feeling of joy and excitement, be it having a cup of tea with your friend, or having your favorite brand of chocolate, or your favorite coffee, or getting a massage, whatever used to bring you this feeling of anticipation and the thought of joy, all these feelings are not there anymore. It's like nothing can make you happy. And also you might feel very tired even after doing simple things, moving slower, having trouble sleeping, feeling restless and not hungry, no appetite, no wanting intimacy. Feeling guilty or worthless is also common, and you're just not going to feel like yourself. These feelings and symptoms can stay pretty much the same each day and don't really change based on what's happening around you. Depression can be mild, moderate, or severe depending on how strong and how many of these symptoms a person has. Now, I want to go through the symptoms one by one. So, persistent sadness, feeling overwhelmingly sad, hopeless, or empty for an extended period of time after childbirth, loss of interest or pleasure, significant changes in eating habits leading to weight loss or weight gain unrelated to post-pregnancy changes, sleep disturbances, difficulty sleeping even when the baby is sleeping or sleeping excessively, feeling constantly tired or experiencing a lack of energy even after resting, experiencing intense feelings of inadequacy or guilt about not being a good enough parent. I mean, you're always going to feel that you're not a good enough parent, but in this case, it's intense. Physical symptoms. Some women may experience physical symptoms such as headache, stomach aches, or muscle pains that are not due to any specific medical condition. Thoughts of self-harm or harming the baby. In severe cases, thoughts of self-harm or harming the baby might occur. These thoughts are distressing and require immediate professional help. So as I have mentioned, research indicates that PPD could damage the connection between the mother and the baby. In situations where the mother is dealing with PPD, the baby might not receive proper care and could experience negativity. As a consequence, this can significantly affect the child's development and learning. Children born to mothers experiencing PPD can display behavioral differences. They might exhibit delays in cognitive skills compared to their peers and might even experience feelings of sadness at an earlier stage in their life. So the best you can do under the circumstances, not knowing whether it can happen to you or not, is prevention. It's crucial to educate yourself about PPD, attend classes where new mothers are taught to recognize signs of PPD and how to seek necessary support, get screening for depressive symptoms during pregnancy. Also, exclusive breastfeeding has shown a positive impact in reducing depressive symptoms for up to 3 months after childbirth. And adequate maternal sleep also plays a role in preventing PPD. So if I was pregnant, I would make sure that I wouldn't stay on my own with my newborn, even with a partner. I would get help, be it either my mom or my cousins or friends or whoever. Make sure that there is always continuous support and help, and not just visitors who come for an hour or two and drop off some food. No, real help. We women are not meant to raise a kid on our own. We always lived in tribes and communities, and there were always our people who surrounded us. So make sure you are not going to be alone after childbirth. I would also do all the research, find a therapist or a doctor who treats PPD. Depending which country you are, there might be different names for the healthcare provider who deals with PPD. And I would get the contacts and find out how to make an appointment with the specific doctor, be it a call or online booking, just to make sure that it is all ready. Because when you are having PPD, you might not be in condition or even interested to look up and search and contact a doctor. It's also a great idea to talk to a partner, your close friend, or a family member and share these details so that they can contact and make an appointment for you and come with you in case you or they suspect PPD. Okay, before wrapping this up, I also want to stress that experiencing a few of these symptoms does not necessarily mean that you are having a postpartum depression. However, if these symptoms persist for more than a couple of weeks and interfere with daily functioning, it's crucial to seek help from a healthcare professional for proper evaluation and treatment. And in most cases, with proper care and support, PPD can be effectively managed and treated. So please talk to your doctor for more information and clarification or whatever other questions or concerns you may have. All right, that is it for today. Stay well, and I will see you next time.